All right, my name is Julian Johnson. I'm a nurse practitioner student. I've got my mother, Rhonda Johnson, who's volunteered to be my patient today for the head to toe assessment. You signed a consent form already and you do consent to the exam, correct?
Yes.
Excellent. So first I would start off by completing hand hygiene. I would ask the patient's full name and date of birth.
Rhonda Johnson, 7/30/66.
Excellent. Where are we, Rhonda?
In the clinic.
Excellent. And could you tell me the month and year we're in?
August 2026.
Excellent. Patient is alert and oriented ×3. I would also take a set of vitals and a height and weight on the patient. Next, I want to assess for any pain that you have on a scale of 0 to 10. Where's your pain level now?
0.
0, no pain at all. Excellent. Looking at the overall appearance of the patient, patient seems calm and relaxed, no sign of distress. I'm looking at the skin from head to toe, no lesions or abrasions seen. Skin is intact. The skin feels warm to touch, and assessing for skin turgor, checking skin turgor, I should say, and there's no signs of dehydration, so it means you're well hydrated. Very good. And starting at we're going to start at the top, looking at your head as normocephalic, symmetrical. I'm going to palpate. You tell me if there's any tenderness.
No.
Excellent. No masses or lumps felt. Next, I'm going to, her hair is evenly distributed across the head. I'm going to test for facial sensation, and I have this Q-tip here. This is going to be dull and this is going to be sharp. You tell me if it's sharp or dull.
Dull. Dull. Sharp. Sharp.
Excellent. Cranial nerve number 5 is intact. Next, I'm going to palpate your frontal sinuses by pushing up on your eyebrows. Any sensitivity there?
No.
Checking the maxillary sinuses. Any sensitivity there?
No.
Very good. I'd like for you to give me a big smile. All right, excellent. And puff your cheeks, raise your eyebrows. Cranial nerve number 7 is intact. Next, I'm going to palpate the temporomandibular joint. If you could open your mouth and then close, very good. There is no popping noted. If you could also, while you have your mouth open, if you could move your jaw side to side for me. Excellent, very good. And assessing for the cranial nerve number 1, for testing purposes, I would just, close one of her nostrils or nares and have her smell a fragrance. She would tell me, if it was cinnamon or coffee, something of that nature. Cranial nerve number 1 would be intact. Next, I'm going to have a look at your nose. If you could look up for me. I am visualizing the left nair, and inside is pink, moist. Turbinates are visualized. There's no obstruction. Moving to the right nair is no obstructions there. It's pink and moist, and turbinates are visualized. And now we're going to start with your eyes. Here I have a Snellen chart. I'm going to place it approximately 14 inches from your face. If you would cover your left eye for me and read the line closest to the bottom that you can possible.
OLCF.
All right, and if you could do the same on the other eye.
OLCF.
OLCF, excellent. And that's 20/50 vision in both eyes. If you would just look straight ahead for me, I'm going to shine a light here coming into your eyes on each side. Patients' pupils are equal, round, and reactive to light. They are approximately 3 millimeters in size. The patient's eyelids and eyelashes are intact, no discoloration, they're symmetrical. Next, I'm going to have you look at my fingertip, and if you would follow my fingertip for me. Patient's eyes appear to be tracking well, fluid in motion, no signs of nystagmus. Cranial nerves 2, 3, 4, and 6 are intact. Next, I'm going to look at the look at your still at your eyes. Switching to the ophthalmoscope. So I'm going to be looking a little bit closer at your eyes here. So if you would just look straight ahead for me, starting with the left eye, visualizing red reflex is seen, coming in closer. The optic disc is yellowish and orange in color. Macula can be seen. The sclera is white and clear, no vessels ruptured, no signs of redness. We're going to move along to the right eye. Red reflex is noted. Coming in closer, the optic disc is yellowish orange in color. The macula can be visualized. The sclera is white, clear. No signs of redness or ruptured blood vessels. All right. Next, we're going to move along to your ears. I have an otoscope here. I would pick the largest speculum that would fit in the ear canal. And I'm going to start with your left ear. Just looking at the outward appearance of the ear, there's no signs of drainage, erythema, edema, anything like that. The auricle pinna tragus is intact. I'm going to pull the pinna of the ear upwards and back while visualizing the ear canal, and there is no obstructions. I can visualize the cone of light. The tympanic membrane is pearly gray. All bony prominences are visualized. Very good. Moving along to the right ear, I'm going to inspect the outward ear, looking for any signs of redness, edema, drainage. None there, looks intact. I'm going to pull the pinna up and out, visualize the inner canal, and the patient's ear is free of obstructions. Tympanic membrane is pearly gray. Cone of light is visible. All bony prominences are present. Excellent. All right. Next, we're going to do the whisper test. So I'm going to turn you around, and if I could have you cover your right ear, and I'm going to whisper a number to you, and you repeat it for me.
44.
Excellent. I'm going to come to the other side, and if you would close your left ear.
55.
Excellent. And cranial number 8. Cranial nerve number 8 is intact. For the final hearing test, I have a tuning fork here. This is a 512 hertz tuning fork. It's called the Weber test. I'm going to strike this on my elbow and place it on the top of your forehead, and you tell me which side you hear the sound most on.
Same.
Same, very good. And that is to be expected. So now we're going to move down to your mouth. Visualizing the outside of my patient's mouth here. Her lips are pink, moist, and intact. No signs of cyanosis. Turn my light on here. If you could open up for me, I'm going to visualize the buccal mucosa as pink and moist. Looking at both sides. There's no signs of ulcerations or redness. I'm looking at the hard palate is intact, pink and moist. Looking at the teeth upwards, no missing teeth, no cracks visible. Same on the bottom. Looking at the tongue, if you could stick your tongue out for me, very good. That's pink and midline. And if you could say ah for me, excellent. You can close your mouth. The tonsils were +1, the uvula was midline, and the soft palate rose symmetrically. Now I'm going to place my hands on your shoulders. If you could shrug your shoulders for me. Excellent. And that would be cranial nerve number 11 and 12 intact. Next, we're going to move down to your neck, looking at the trachea. Trachea is midline, no deviation noted. Checking for jugular vein distension. I'm going to auscultate your carotid artery for any bruits with the bell of my stethoscope. None noted. Very good. Now I'm going to turn you around once more. And I'm going to palpate your thyroid. So you tell me, is there any tenderness there?
No.
All right. There's no swelling or goiter present. Very good. I'm going to go ahead and palpate the occipital lymph nodes. Moving to the postauricular, to the preauricular, to the tonsillar. Checking the submandibular lymph nodes and then submental. Posterior cervical, anterior cervical. And then Rhonda, if I could have you shrug your shoulders up and then forward for me. Checking the supraclavicular lymph nodes. Very good. Excellent. All right. Now, I'm going to turn you back around and we're going to have a look at the thorax region, looking at your chest. I'm going to have a listen to your lungs. Take a deep breath for me. Good. Deep breath. Good. Again. Good. Again. Good. Again. Good. Again. Good. Again. Good. Again. Good. Lung sounds are clear in all quadrants. No signs of wheezing or crackles or rhonchi, anything like that. If you could say the word 99 for me.
99.
Again.
99.
Again.
99.
Patient is negative for tactile fremitus. I'm going to have a listen to your heart. I'm here. Listening with the diaphragm and the bell of my stethoscope. Listening to the aortic valve first. Moving to the pulmonic valve. And then to the tricuspid. mitral. And then next I'm going to palpate for the point of maxillary impulse, point of maximal impulse. And then I'm gonna listen. Heart sounds S1 and S2 are present, no murmurs heard. All right, next we're going to do the same, but on the back side here. All right, listen. Deep breath. Very good. Again. Very good. Again. 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 And one more. Very good. Lung sounds are clear. And if you could say the word 99 for me.
99, 99, 99.
Very good. All right. Now, I am going to percuss over each quadrant of your lungs here. And resonant sounds in all quadrants, which is very good. All right, next I'm going to check for CVA tenderness. So I'm going to find the costovertebral angle here, and I'm going to tap my fist on your back. You tell me if there's any tenderness, okay?
Mm-hmm. No.
Any tenderness on either side? No, okay. Very good, all righty. Now, for this next portion of the exam, I'm going to inspect your abdomen. So if you would, please come to my exam table over here, and you can have a seat and lay down there. I'm going to move the camera so you can see. All righty. Let's see. Okie doke. All right. I am inspecting the abdomen of the patient, looking for any masses, any bulging. No signs of hernia are noted. Looking at the contour, I'm going to auscultate all 4 quadrants. Vowel sounds are present and normal active. Next, I'm going to percuss over each quadrant. All right, good. And then I'm going to lightly palpate. And then I'm going to palpate deeply, and you tell me if there's any tenderness. While doing this exam, I'm observing my patient's face, looking for any grimacing, assessing for any rebound tenderness. All right, excellent. Now I'm going to feel for your liver here. Liver can be palpated. And now I'm going to palpate for the spleen. Which I'm having a hard time palpating. So we'll move along to the kidney on the right side. If you could, yeah, thank you for pulling your legs up there, and then we'll back here. Feeling for the right kidney. All right, thank you. And then we'll move to the left. All righty. Any pain or tenderness there at
No.
all? Okay, good. This a specialized exam that I've chosen is the Murphy sign, and if I suspect cholecystitis for my patient, I would ask them to inhale, and I would palpate just under the inferior costal region on the right side, and I'm going to ask you to inhale, and when you do, I'll push upwards and inwards. All right, if you could inhale for me. All right, and any tenderness there?
No.
No tenderness noted, very good. Alrighty, I think that's it for the abdomen section. We can pull your shirt back down for you and I'll help you up here. And you can have a seat for me there. I'll move this camera back. All right. Okay, make sure we're good. All right, now we're going to check for capillary refill. So I'm gonna look at your hands here and looking at all the nail beds here. Nail beds are pink, both hands. All right, and capillary refill is less than 3 in each fingertip. No signs of clubbing at all. All right, and then we are going to palpate your pulses. I'm going to start with the carotid pulse here. Pulses are equal and +2. Feeling the brachial pulses, equal, +2. Moving to the radial pulses, equal, +2. Moving to the popliteal pulses, equal, +2. Checking the dorsalis pedis pulses are equal, +2. And then the posterior tibial pulses are equal, +2. Excellent. No edema noted in the feet. All right. Now, next I would like for you to stand for me. If you could put your feet together and your arms by your side and close your eyes for me. And hold your arms straight out. Keep your eyes closed. All right. Very good. You can place them back. Patient is steady, no signs of falling, has great balance, and that completes the Romberg test. If you would, take a few steps forward for me in a regular fashion, and then come back the other way. Excellent. Patient is steady on her feet, gait is excellent. If you can have a seat now for me. All right. And next, I'm going to check your deep tendon reflexes, starting with your tricep reflexes. If you could dangle your arms by your side for me. Excellent. And I'm just going to tap the back side of your arm here. All right, then the brachial reflexes. All right, and then if you could dangle your legs for me, I'm going to check the patellar reflexes. Excellent. Excellent. Good deal. All reflexes are reactive. That's right, and now we're going to run through some range of motion exercises. I'm going to ask you to place your arms above your head, and then out in front of you, and then all the way down by your side, and then behind you, and in front of you. And if you could hold your arms like this, then outwards, inwards, here, inwards, outwards. Excellent. Patient has great range of motion. We're going to check for strength next. If you could hold your arms like exactly, and then pull up. Excellent. And then you can keep your arms like that, and then press downwards. Excellent. All right, and then we're going to do the same on the lower extremities. I'm going to apply resistance to the front of your legs, and you push outwards. Excellent. And then applying to the back and pull inwards. Excellent. Patient has great strength in the lower extremities as well. Now I'm going to turn you back around and examine your spine. I'm looking for, if you could bend forward for me. Exactly. Usually the patient's shirt, I would have it up so I could visualize the spine, make sure that there's no curvature, no signs of scoliosis. All right. And then I'll turn you back around. And then one specialized test that I chose for the musculoskeletal portion would be the Phelan's test. So what I'd like to have you do is place your hands together like this in front of you with your wrists flexed, and then I would ask you to do this for 60 seconds, and if there would be any pain or tingling, numbness in the thumb, index, or ring finger at all, that would be a positive for carpal tunnel syndrome. All right, you put it back down. And I believe that concludes the exam. You have any questions for me at all?
No.
All right, thank you for being such a good patient.